Huge array of electoral malpractices virtually in all the states of the Federation before the actual voting began.
The year 1998 was not particularly good for Nigeria. There was political crisis in different nations, but the one in Nigeria occasioned by the controversial annulment of the 1993 presidential election generated global interest. The political logjam became compounded with the sudden death of two of the key actors, Moshood Abiola, the presumed winner of the election, and the then head of state, General Sani Abacha. Their sudden and shocking deaths were blamed on heart failure, a cardiovascular disease. Before that incident and after it, several Nigerians have lost their lives prematurely due to heart failure, raising the critical question, why?
The common denominator there is hypertension. Ask everybody to know its roots. Where are you coming from? Did your father have hypertension? Did your mother have hypertension? Did any one of them suffer the stroke? You are a likely candidate.
Cardiovascular disease has always been regarded as a disease of affluence, but this has changed drastically. The World Health Organization says over 4.5 million Nigerians above the age of 15 are suffering from one form of cardiovascular disease or the other.
Hypertension is a cardiovascular problem, but more importantly, it predisposes one to having heart disease because it affects the structure and function of the heart.
I don't think we're taking our health seriously. People are joking about everything.
Adding this to our already poor health situation in the country, the trend becomes even worse. For these cardiologists, public awareness and lack of implementation of policy is a major problem. However, it is believed that for the country to scale through the danger, everyone must shape in his or her skills in advocacy to be able to engage government and all key players on these issues.
The population is too big for the number of specialists we have. We need to strengthen our healthcare, the primary healthcare system. There should be blood pressure monitors there. The nurses there should be able to test the urine, and then even after we have seen the patient and make the diagnosis, we need to send the patient back to where they will have follow-up. That's the only way we're going to get the health of Nigerians, to really improve.
In the light of this critical period Nigerians are meant to go through, what can they do to reduce the risk of cardiovascular disease?
We recommend that, according to WHO, for cardiovascular fitness, people should walk for about 30 to 45 minutes daily, most days of the week. The other thing that is known to help is that you also make sure that you eat healthy. Reduce your salt intake. Periodically, you are supposed to check your numbers, that is your blood pressure, your cholesterol, your blood sugar, and things like that.
Now that we are faced with the worst challenges, it is expected that we focus on our health in order to stop this disease from taking our lives or that of our loved ones at their prime. Ogom Ezedimbu, AIT News, Abuja.